Every man thinks he knows what positions women truly enjoy, but here's something that might surprise you. Most are completely mistaken. And I'm not saying this to be provocative, but because I want to open an honest conversation about intimacy, physiology, and real connection. Well, I'm Dr. Nerea Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health or intimate wellness, stay with us. We're here to help you understand your body with clarity and comfort. I've spent over 3 decades at Mayo Clinic in Rochester, Minnesota, helping couples rebuild trust, restore connection, and rediscover genuine intimacy. Throughout my career, I've heard thousands of variations of the same story. Men who are genuinely trying, who truly care, who love their partners deeply, yet they find themselves wondering why she seems distant or disengaged, especially in moments when they should feel closest. And here's what I've learned. The answer almost never lies in a lack of desire. It's in the physiology. It's in understanding how a woman's body actually responds, what she needs to feel safe, comfortable, and most importantly, fully present in the experience. In this video, we're not going to talk about tricks or Hollywood fantasies. We're going to talk about human science, practical anatomy, and respectful intimacy. I'm going to walk you through 5 positions that women genuinely prefer, not because they're trendy, but because they align with how their bodies work. I'll also share 2 extremely popular positions that often cause discomfort in reality, despite what the media portrays. Most importantly, you're going to learn the why behind what works. By understanding angle adjustment, rhythm, and friction, you can create experiences that feel natural and satisfying for both partners. If you stay until the end, you'll understand a simple principle that transforms any intimate relationship. True intimacy isn't about doing more. It's about feeling better, reading your partner's body, and responding with intelligence and care. Let's begin. Understanding the foundation. Before we explore specific positions, there's one simple truth that will change how you understand intimacy. And if you don't grasp this, everything else will feel confusing. Most men, even the most attentive ones, assume that a woman's pleasure depends on the same things that bring them pleasure: rhythm, depth, and intensity. But a woman's body doesn't work that way. Her pleasure is built on 2 pillars that must exist simultaneously. First, steady, comfortable blood flow to the pelvic tissues. Second, reliable external stimulation at the front of the pelvis during internal movement. This combination, blood flow and friction together, is what allows the brain to receive the right signals. Without both elements present, even with tenderness or desire, sensation becomes scattered and fades. For years, studies reviewed by experts in sexual medicine have confirmed something surprising. Only a small percentage of women can reach climax through internal movement alone. The vast majority need or prefer synchronized external stimulation, because that's where the greatest concentration of nerve endings exists. So when a man relies solely on depth or speed without maintaining consistent frontal friction, he may feel confused. He thinks he's not doing enough, when in reality, he's doing too much of the wrong thing. I've seen couples married for 20, 30, even 40 years rediscover their connection with one small adjustment: reducing the range of motion and maintaining steady anterior pressure. Nothing more. A woman's body responds to rhythm and consistency, not urgency. Here's another point many people forget: nervous system relaxation. When a woman feels tense, rushed, or forced to adapt to an uncomfortable angle, her brain interprets sensation as something to control, not enjoy. But when she feels safe, when her body receives gentle friction, the parasympathetic nervous system activates. Circulation improves. Sensation flows naturally. That's why the preferred positions aren't the most visually impressive. They're the ones that allow for easy frontal contact, gentle angles, and freedom of movement without strain. This will be our roadmap for the rest of this video. We're not searching for perfect positions. We're searching for intelligent adjustments that honor physiology and prioritize comfort for both partners. From here forward, every position we examine will include 3 elements. 1. What makes it unique from a clinical perspective. 2. How to balance it for greater comfort. 3. What signals to watch for to know it's working. Let's begin with number 5. Position 5. Side by side, the silent spoon. This position looks simple, almost too everyday to be at the top of a list, but in clinical practice, it's one of the most effective and beloved by couples seeking comfort, connection, and sustained intimacy. Lying on your side reduces muscular effort, protects the joints, especially for people over 60, and allows for continuous closeness without losing eye contact or physical tenderness. From a medical standpoint, this position keeps the pelvis aligned and creates a smooth, gliding internal angle. This anatomical detail is crucial. It prevents deep thrusting that can cause discomfort and makes it easier to control pressure. It also frees one hand to stay active at the front, helping maintain the external stimulation we discussed earlier. Clinical tip: place a small pillow or folded towel between the knees. This aligns the hips and prevents pelvic rotation, which can cause lower back strain. Keep your movements short and rhythmic, like a gentle rocking motion. The key isn't force, it's maintaining friction between the base of your pelvis and the front of her body. When that friction is continuous, sensation multiplies, and a woman's body responds without needing speed. In practice, many couples find this position sweetest when they alternate between short movements and gentle hip swaying. There's no rush. The secret is consistency, breathing together, rather than searching for depth. Position 4, seated face-to-face, edge or chair. This position is as practical as it is intimate. One partner sits on a solid surface like the edge of a bed or a stable chair, while the other sits on their lap, face-to-face. Physiological benefits. Direct eye contact stimulates oxytocin release, the bonding and trust hormone. Chest-to-chest contact helps synchronize breathing and reduces muscle tension, improving steady blood flow. In this angle, the seated partner's pelvis stays stable, while the partner on top controls rhythm and depth. This stability transforms friction into a rocking motion, maintaining consistent pressure on the front of the pelvis, exactly where most women feel the greatest pleasure. Clinical tip: think in terms of rotation and pressure, not thrusting and pulling. Keep the base of your pelvis in full contact. If you want to change intensity, simply tilt your torso slightly back or forward to adjust the angle without losing alignment. Hands are free. One can maintain balance, the other can provide external stimulation. This position is also excellent for older adults or those with limited mobility. It doesn't require strength or flexibility and can be maintained longer without fatigue. Position 3, face-to-face reclined, the classic rediscovered. Some call this the most traditional, but when performed with attention and knowledge, it becomes one of the deepest in emotional and physical connection. Body to body, breath in the same rhythm. It allows you to read subtle facial expressions, something sexual medicine considers a factor in nervous system synchronization. When a partner can read signals of pleasure or discomfort, the nervous system adapts and the body responds better. From a clinical perspective, face-to-face maintains a neutral penetration angle. You can improve it by placing a small pillow under the receiving partner's hips. This tilts the pelvis and aligns the internal surface with the most sensitive area at the front. Clinical tip: shorten the range of motion and apply gentle forward pressure at the end of each movement. This sustained pressure prevents sensory interruption, and continuous frontal friction maintains the synchronized stimulation most women need. If you want more intensity without increasing depth, don't use more force. Change the angle with a folded towel. Small adjustments, big results. This position also enhances nonverbal communication. Touch, kissing, eye contact all activate brain regions associated with pleasure and calm. A relaxed body feels more. Position 2, woman on top, conscious control. This is the position of conscious control, and it's often the most underutilized by older men. Here, she determines the angle, rhythm, and depth. She can adapt at any moment, adjust her posture, and direct sensation to where she feels it best. This not only increases her pleasure, but also reduces the risk of discomfort or pain, which is essential in older age. In large clinical surveys, most women describe how they intentionally adjust their hip angle to maintain sensation at the front of the pelvis. This position allows for that naturally, effortlessly, and freely. Clinical tip: forget rapid vertical movements. Think circular motions or gentle swaying while keeping the pelvis pressed against your partner's pelvis. This way, external friction stays continuous and blood flow isn't interrupted. If the knees get tired, there are safe variations. You can support yourself with your hands on your partner's chest, or advance one knee to reduce muscle strain. You can also partially lean back on a pillow. This position also has a powerful emotional benefit. The sense of autonomy and control increases confidence and communication because it reduces the fear of discomfort. And when the body feels free, pleasure flows naturally. Position 1. From behind, precision and alignment. This position, often misunderstood, generates conflicting opinions in surveys. Some women find it too intense, while others describe it as one of the most pleasurable. The difference lies in angle adjustments, rhythm, and friction. When done without attention, it can feel too deep, too forceful, or impersonal. But when done with proper alignment, it becomes one of the most complete. Clinical principle. The secret is in the tilt. If the receiving partner bends their knees slightly and rotates their hips slightly forward, the internal angle changes. Instead of direct backward pressure, friction falls on the front internal surface, where tissue is most sensitive. Clinical tip: place a pillow under the hips for precise angle adjustment. Use slow, gliding movements. Don't push with force. Keep one hand steady at the front to ensure continuous external friction. And most importantly, communicate. Ask, look, feel. Trust doesn't interrupt the moment, it deepens it. In recent studies, couples who apply these adjustments report significant increases in pleasure and emotional connection, especially when movement is gentle with pauses and shared breathing. All these positions share one thing in common. They're not seeking performance. They're seeking alignment. They focus not on force, but on maintaining frontal friction and preserving continuous blood flow. This is what science confirms, and it's what thousands of couples discover when they stop trying to impress and start listening to their bodies. 2 popular positions to avoid or transform. So far, we've discussed the 5 positions that best promote comfort, flow, and emotional connection. But in my practice at Mayo Clinic, when I speak with older couples, the same question always comes up. Doctor, what about the positions in movies? Are they really as good as they look? The answer is clear. Not always. Some look spectacular, but are physiologically unsustainable or even counterproductive. Let's look at 2 of the most common. 1. Standing shower position. In theory, it sounds romantic, spontaneous, passionate. In practice, it's a physical challenge. The female body rarely enjoys it. Medical reasons. Slippery floors reduce movement control. Muscles tense to prevent falling. Water washes away natural lubrication, making tissue more sensitive and potentially causing minor irritation. The internal angle is often too vertical, creating abnormal pressure on the cervix. The result? Discomfort, tension, and complete loss of frontal stimulation. How to transform it? If you love the idea of a water environment, step out of the direct water stream. Use a stable surface like the edge of the tub or a solid bench that both partners can lean on. This restores balance and allows for eye and frontal contact without forcing awkward positions. The moment retains the same intimate atmosphere, but now it's safe, comfortable, and real. 2. The acrobatic position, knees near ears. Extremely popular online. Almost always problematic in real life, especially for women over 45. Medical reasons: this position requires extreme flexibility in the hips and lower back. It causes strain on pelvic ligaments and can compress lower back nerves. The entry angle is often too direct, putting pressure on sensitive areas. What looks like depth on screen often feels like pain or overexposure in the body. How to transform it? To capture a similar sense of openness and closeness without strain, place a firm pillow under the tailbone or hips. This reduces knee bending and smooths the internal angle. Movements should be short, slow, with conscious breathing. Adding a hand at the front or gentle touch on the abdomen helps maintain sensation in the place of true pleasure. Both positions show the same error pattern. They prioritize appearance over sensation. That's the opposite of what conscious intimacy seeks. Couples who enjoy each other most, especially after 50 or 60, are those who read signals, Adapt and replace urgency with alignment. Passion isn't measured by acrobatics, it's measured by the connection you achieve without words. The core principle: continuous frontal contact. At this point, many men ask me the same thing in my Mayo Clinic practice. So everything comes back to one small area at the front of the pelvis? Not exactly, but understanding this principle changes the entire experience. Most sexual medicine studies over the past 20 years, including research from Indiana University and the Kinsey Institute, agree on the following. A small group of women can reach climax solely from internal movement, but most need or prefer synchronized external stimulation. And not just for intensity, but because this combination allows the body to respond in a more balanced and pleasurable way. From here emerges a simple, elegant rule. Choose and adjust positions that maintain continuous frontal friction. Then think about depth, speed, or rhythm, not the other way around. If you prioritize depth before establishing steady friction, pleasure scatters. The brain stops recording sensation as pleasure and interprets it as repetition. That's why what looks like intensity often becomes disconnection. 3 practical ways to maintain continuous sensation. 1. Breathe together in the first 30 seconds. This may seem trivial, but it's not. Synchronized breathing activates the parasympathetic nervous system, responsible for calm and emotional connection. When both breathe in the same rhythm, pelvic muscles relax and circulation increases. A calm body feels more and responds better. 2. Shorten the range of motion. In population studies, most women who describe pleasurable experiences talk about short movements with sustained forward pressure. A woman's body doesn't need large in and out movements. It needs continuity. Think balance, not pushing. When you maintain frontal friction, blood flow is preserved and sensation isn't interrupted. 3. Use smart support. Pillows aren't a compromise. They're clinical tools. A folded towel under the hips can completely change the internal angle, aligning the friction surface. This way, you avoid using more force and achieve greater comfort and control. In older couples, this simple adjustment can make the difference between effort and harmony. The role of rhythm and body awareness. The ideal rhythm isn't fast or slow. It's the one that maintains continuous forward pressure. In the first few minutes, a steady rhythm, almost meditative, allows a woman's body to recognize sensations and imprint them on the nervous system. Only when she begins to respond clearly through her breathing, movements, or voice can you gradually increase depth or speed. Doing so beforehand is like building on sand. The body hasn't found its foundation yet, and one essential element, mental presence. The strongest friction isn't always in the hands or body, it's in attention, listening, observing. Noticing how her breathing or vocal tone changes is the most accurate way to guide the moment without guessing. The body speaks. Science just translates its language. Subtle adjustments, tilting and swaying. In recent medical research, 2 movements, despite being small, are described as transformative: tilting and swaying. Most women use them unconsciously. Tilting changes the internal friction angle, while swaying maintains continuous frontal contact. Small, slow movements coordinated with breathing. When a partner accompanies them, nothing more is needed. The body finds its own rhythm. Keeping a hand or point of friction at the front of the pelvis, whether with hands on the abdomen or a gentle accessory, is the difference between almost and this is it. This isn't opinion, it's evidence. Studies show that women who receive continuous external stimulation during intercourse report significantly higher climax rates than those who don't. And none of this requires technique, just conscious attention and gentleness. The art of mature intimacy. Understanding these small details, breathing, pressure, rhythm, angle, doesn't reduce spontaneity, it creates it. Surveys about preferred positions are helpful, but they hide a detail that science confirms every day in clinical practice. There is no single perfect position. What mature women and couples love most isn't a specific position, but the condition, the ability to adjust the angle and maintain frontal friction effortlessly. This means positions are starting points. you adjust them. True pleasure emerges from the personal adaptation each couple creates within them. When I see couples over 60 who've restored their connection, I notice a clear pattern. They don't focus on technique. They focus on listening. They've learned to read small cues, faster breathing, a subtle hip movement, a barely audible sound, and they respond with attention without breaking rhythm. This ability to read the other's body is a form of emotional wisdom. You can't learn it in a book, but you can cultivate it through presence. 3 signals that guide better than any manual. 1. Breathing. When breathing becomes deeper or rhythmic, the body is aligned with sensation. If she holds her breath, it's a signal of tension. Slow down, change the angle, or come closer to restore friction. 2. Stillness. Often the strongest moment isn't in movement, but in pause. When both remain still for a few seconds, the brain interprets that stillness as safety. Tension decreases, sensation spreads. Learn to hold that silence. It's not emptiness, it's fullness. 3. Muscle tone. A relaxed body feels warm and receptive. A tense or rigid body is protecting itself. If you notice resistance, don't insist. Adjust your position. Support with a hand. Speak gently. Gentleness doesn't interrupt passion. It deepens it. Communicating with grace talking during intimacy isn't weakness. It's a sign of maturity. A simple phrase like, "Does this feel good?" or "Do you want me to stay here?" can open a door of tremendous trust. Gentle communication reduces anxiety and activates the brain's reward system, creating an immediate sense of closeness. Let me put it this way. In my workshops at Mayo Clinic, I say this: the body has its own language, but the voice can be its most precise translator. Asking doesn't extinguish the moment, it illuminates it. Mature intimacy isn't about discovering new positions every night. It's about rediscovering the same person with deeper understanding. Sometimes a small adjustment is enough. A higher hip, a shorter movement, a firmer hand, for the body to feel at home again. Practical application guide. If you're seeking closeness and connection, start face-to-face. Keep movements short, smooth, synchronized with your breathing. Support a hand on the front of the pelvis and press your body forward, not backward. The goal isn't depth, it's continuity of friction. The more stable the pressure, the easier it is for both to relax and unite. If she wants more control over rhythm, invite her to be on top, face to face. Let her set the angle, speed, and sway. Don't worry about her guidance. A woman's body knows how to find its point when given freedom and support. Your steady, calm presence is stronger than any rapid movement. If both want a deeper internal sensation, try from behind, but with attention. Before starting, place a pillow under her hips to adjust the angle and reduce depth. Keep one hand or gentle pressure at the front. The combination of internal and external friction is what transforms an intense position into a pleasurable and safe experience. And if you want to close with calm and tenderness, shift to the side-lying spoon position. Breathe together without rush. At this point, words aren't needed. Body warmth, chest rhythm, and shared breathing become the most human language there is. The thread that connects everything. The thread connecting everything isn't technique or a hidden secret in a book. It's a simple, universal principle. Steady comfort at the front of the pelvis, an adjustable internal angle, and movement that preserves sensation. Research shows this. Bodies confirm it when they learn to listen to themselves. And this transforms any moment into a truly intimate memory. In sexual medicine, we often say that pleasure is an advanced form of communication, not performance, understanding. Let the body speak and respond with attention. Mature love doesn't seek to impress, it seeks to understand. After 60, the body changes. But sensitivity doesn't disappear. It just needs new conditions to express itself. Every muscle, every breath, every pause can be a bridge between two people who choose each other with respect. I'm a urologist at Mayo Clinic in Rochester, Minnesota. My hope is that this knowledge serves you, not just to improve your intimacy, but to live it with more calm, compassion, and science on your side. If this video helped you see things more clearly, share it with someone else who wants to learn how to care for connection with gentleness and curiosity. Because true intimate health doesn't begin in the body alone. It begins in the way we choose to look, touch, and listen to each other. And remember, age doesn't extinguish desire, it refines it. When you understand what truly matters, every touch becomes an act of wisdom. Thank you for being here. Take care of yourself and your loved ones, because you are worth it.